Hello, I'm Dan Murphy, the medical director of the Bairo Pite clinic in Dili, East Timor. I've been here since 1998 and am very busy working with all the sick patients in our clinic. One of the problems that we deal with every day, and a problem that many people around the world have forgotten about but need to be reminded, and that is tuberculosis. If we go back in time, we now have technology that we can find the DNA of tuberculosis in ancient mummies, in bodies in the Indian populations of the Americas. In fact, in most parts of the world, they have now found that TB is one of the earliest diseases. And through the years, by far, TB has killed more people and affected more people than any other disease. My work in different parts of the world, and even in the United States, especially working with minority populations, has always involved many cases of tuberculosis. It seems as though instead of getting closer to eliminating this disease, it seems to grow and grow. If you look at the world overall now, 1/3 of humanity is probably infected with tuberculosis. Not all of those people are actively ill, but tuberculosis has this wonderful characteristic of being able to stop its metabolism and hide within the human body, and then when conditions are right, it comes forward again, and you have active tuberculosis. It's caused by a bacteria which has a very thick coat made out of lipids, and this protects it so that it's not so easy to get rid of this bacteria, and it will live on and on and on. The reason why so many people have tuberculosis is because they live within close proximity to other people. So I would say population density is the #1 risk factor for tuberculosis. In Western countries, as people's economic development progressed, housing got better, and when we look at our own experience, most people have their own bedroom. They breathe their own air. Not so in poor countries. In East Timor, just like in the Aboriginal communities in Australia, many people live in one household, sometimes 10 or even more people living in one house, and there may only be 2 or 3 rooms. Also, as you're near the tropics, nighttime is longer, and people breathe the same air for long periods of time. Usually, if one of the adults is coughing the whole night, maybe they have tuberculosis with a large number of bacteria. Those bacteria come out in the air in little droplets, and they float around in the air for hours. At nighttime, by the time you breathe that air the whole night, by the next morning, probably quite a number of those tuberculosis bacilli get down into your lungs all the way down to the alveoli, and you have TB infection. Your body can usually come up with some kind of immune response and try to surround that disease and maybe keep it under control, but as much as 1/3 of the cases, your body can't do that, and the disease progresses on and on. If you would happen to have a condition, HIV, your immune system does not function well at all, and most of those people will get active TB and even what we call extrapulmonary TB, which means it goes to other parts of the body. Our experience here in East Timor is that even though we're very aware of TB, we still underdiagnose this condition. I always tell the medical students, make sure you rule out tuberculosis in every case that you see. And you have to keep such a high level of awareness or you're going to miss the cases. Virtually every part of the human body can be infected by TB. And even though I've been working here since 1998, I am still surprised at the diversity, the many ways that this disease can show up, and how challenging it can be to try to diagnose it and then come up with the appropriate treatment. One other huge problem that almost inevitably surges forth is that TB always changes its metabolism, and it has a small amount of naturally occurring resistance to all the medications that we use. As TB multiplies, and those bacteria with a certain advantage of being resistant to the medications we're using grow in numbers, we end up with a condition that's called multi-drug resistant TB. There haven't been new medications for TB in 20 or 30 years now. So sometimes we're left with very unusual medications to use that are not so effective. They're more toxic, they're more expensive, and they have to be given for a long period of time. When you're dealing with multi-drug resistant TB, sometimes you have to treat for up to a year and a half. And some of that is injections every day. Many people don't tolerate it. They don't like to be under treatment that long. And it's a tremendous challenge to control the multi-drug resistant TB. Some parts of the world now, 20, even 30% of the tuberculosis is multi-drug resistant. And it only stands to reason that if you eliminate all of the easy to kill germs, you'll be left with the difficult ones, and then they will spread. So what we have to do is come up with ways to catch the disease early, stop the transmission from person to person, make sure people comply with their treatment, and improve socioeconomic conditions so that we don't get so many more new cases. In East Timor and in much of the world, this challenge is very difficult. Luckily, we don't have so much HIV yet, although the incidence of HIV is increasing. What is really needed is involvement of the community. Part of what we're doing now, working with a group from Portugal, is to try to organize women in the community, and some men, to become TB monitors. They are the ones that will know if anyone in their village has a cough for 3 weeks or more, or is coughing up blood. Those are the people that we have to test, and if they're positive, we need to be sure that they take their treatment, which in our country means for 8 months straight. Trying to diagnose TB is also a challenge because we still use the same old-fashioned microscope to look at the sputum or the phlegm of people that has been done for the last 40 years. There are a few techniques to try to make the disease show up a little easier, like concentrating the sputums. We're trying to implement some of those things. There are other scientific techniques that make the diagnosis easier. We're trying to find a way to implement those. And then using X-ray. Until now, we depend on taking a good history, being able to communicate with people in their own language, having enough rapport with people so they tell you the right story and you're able to come up with the right diagnosis. And then using the smear to be sure that a person has the contagious form of the disease, and we even use isolation, or what you would call quarantine for people who are coughing up large numbers of bacteria. Those are the people who could spread the disease to 20 or more people every year. So it's important, while they're starting their treatment, to be in quarantine. Doing all of this, we hope that we can reduce the numbers, and hopefully in the near future there may be better vaccines, there may be new medications that work better, and if we can keep people's immune system working by not having HIV at such high rates like much of the world, including Brazil and sub-Saharan Africa, but also now in the countries surrounding East Timor, Indonesia, China and India have higher rates of HIV, and they also have lots of tuberculosis. So when you look at the overall picture, this is a tremendous challenge, and if you're practicing primary health care in any of these countries, you cannot be too aware of this horrible problem. My message to all of you, especially if you're within the healthcare system, is keep studying about TB, keep thinking about it, maybe even dream about it a little bit, and hopefully you won't miss cases, especially contagious cases, and dedicate yourself to doing a good job to develop systems locally and nationally so that we can reduce this tremendous burden on humanity.